like to discuss the role and future sequencing of bispecific antibodies in diffuse large B-cell lymphoma. Diffuse large B-cell lymphoma is the most common B-cell malignancy within the United States. It is most common B-cell malignancy actually within the US and Western Europe. It is an aggressive disease, typically in a situation where patients will present with B symptoms, which are fevers, night sweats, weight loss, anorexia, or fatigue. More than likely, patients will have some evidence of pain or discomfort from the disease or palpable lymph nodes on clinical biopsies or some other clinical feature that leads to the diagnosis. In our frontline setting, meaning patients who are untreated and newly diagnosed, the treatment is typically a regimen of about 5-drug cocktail, either R-CHOP or R-CHIP-POLA, based on prognostic scoring system, stage of disease, and sometimes histological subtype, whether it's germinal center or non-germinal center. We anticipate we will cure approximately 2/3 of the patients with this upfront intensive chemoimmunotherapeutic regimen. Those who fail to respond to upfront therapy fall into our relapse refractory category. Of those patients who are relapse refractory, or we'll just abbreviate second line and beyond at this point, the time of relapse dictates whether those patients will be referred for further chemotherapy, followed by consolidation with a stem cell transplantation, or chimeric antigen receptor therapy, which is a newly approved therapy for those who are primary progressive, meaning do not respond to frontline therapy or relapse within a year of receipt of frontline therapy. Thereafter, for those patients who fail to respond to second-line therapy, in the third-line space is where we have these bispecific antibodies. Bispecific antibodies are humanized antibodies which will bind to a patient's T cell and then redirect them to the patient's malignancy in this situation through CD20. There are currently 2 bispecific antibodies approved in the space of patients with diffuse large B-cell lymphoma. There is an intravenous molecule called glofitamab, which is produced by Genentech, and there is a subcutaneous molecule called epcoritamab, which is produced by Genmab. In the pivotal phase 2 trials for both of these agents, both indicated that, both demonstrated, shall I say, overall response rate that ranged from 50 to 60%, but more importantly, approximately 39% of patients in both trials obtained what we call a complete response, which indicates that the disease was not detectable on imaging at various time points throughout the treatment course.